Hello, my name is Ireland Boothby, and this is my show off number 5. I'm doing it on the facial nerve or the cranial nerve 7. This type of nerve is a mixed nerve because there's motor and sensory components. There's 2 motor components and 2 sensory components. There's a lot of different branches of this nerve as well, so it's a little bit confusing, but you can just kind of imagine it all in the cheek area. An interesting thing about this is it is also part of our taste sensory, and so it is connected with our taste in our tongue. The name of the nuclei, it's within the pons, which is these structures here. You have your visceral motor nuclei and the brachial motor nuclei. The visceral motor is superior, and it's salivatory, which is nuclei, and then lacrimal nuclei. The preganglionic automatic neuron is where they originate. Brachial motor, that's where it exits via the inferior pons and then through the stylomastoid to go out of the skull. You have your ventral motor nucleus and your dorsal motor nucleus, and we'll go over those a little bit next slides. But you can see that the branches that I was talking about, you have your temporal, your zygomatic, your buccal, mandibular, and cervical. So those are really just like anatomical names for all the areas, which is really easy to remember because those are the nerves for the mandible, the buccal area. Zygomatic is your cheekbone. Your temporal is right here where your temple is. And then cervical, of course, is your neck. So that's kind of an easy visual way to remember kind of the different branches and where the facial nerve goes. What speech muscles that it innervates, like I say, since there's so many branches, it's going to innervate a lot of them. So you have your facial muscles, which is your orbicular oculi, zygomatic, buccinator, orbicular oris, labial muscles, stylohyoid, stapedis, posterior belly of the digastric, and then the submandibular and sublingual glands. Your taste, that's going to be your fibers. They're mainly innervated in the anterior 2/3 of the tongue, and some innervate into the hard and soft palate. So that's a lot of muscles, but you can kind of see here's a picture of like all the different types of taste, and it's going to be mainly on that front part of the tongue, the 2/3 of the tongue. There's nothing really, there's just bitterness in the way back, but you're going to taste everything else more in the front part of your tongue. You can see on here all the muscles. Here's like the zygomatic where your cheekbone is, orbicular oculi, orbicular oris. Those are going to be to control your lips and eyes. This helps with speech. Your buccinator also helps with chewing. It helps push back your food in your mouth. So they're really helpful. Orbicular oculi is like moving your eyes, your muscles around your eyes. So all of these are really important for your whole facial structure and to keep it working. Next is if the nerve is paralyzed. It's really interesting because the dorsal is bilateral and the ventral is contralateral. So with whatever part of your face that is paralyzed, a doctor can tell what part of or a neurologist can tell what part of the nerve is damaged. So, for example, up here, they have a little lesion up here as supranuclear. So that's before they cross over. So, it's going to be just the bottom left side of the face. Then over here, it's past the nucleus here, and it's in the lesion of the facial nerve. So it's going to be half of the face. So it's kind of interesting to see that. And I kind of just drew this little picture here. It just shows how the dorsal is laterally controlled, and the ventral is contralaterally controlled. What you'll see a lot is, like, your drooping eyes, the nose isn't gonna be as taut, and you'll have drooping of your mouth. But this picture is, like, how I understood it, so it makes a lot more sense, other than just saying, "Oh, it's bilateral, contralateral." I like to see a picture of it. Okay, so how to test the facial nerve. Um, you can test the motor by accessing the upper and lower half separately. You wanna look at the symmetry of the face at rest. You wanna look at the forehead, your eyes, mouth, and your stampedal action. Your stampedal action has to do with your ear because you have your, stapes, is that front of that word? And so it's just that muscle that goes back, I think, right here. You wanna make sure that there isn't any drooping, like I said earlier, and you can, a neurologist can also test it using these wires to kind of judge where all the drooping is. Also your sensory, you can judge that just by taste. You can have like see if they taste salty, see if they taste sour, taste bitter, sweet, just to kind of understand what nerves are damaged. And that's all. Thank you so much.